So today I'm reviewing the Backmate. So you can see there, the Backmate. The idea behind this is that this is going to fit in your door. It's going to open up and tightly get into that door. And then there's a couple of parts here where you can mobilize, work out knots in your back, help maintain some motion of your spine. Now, it's interesting to me because we do something similar with this. I mean, you've got the foam roller, for example. The foam roller is going to roll up and down your back. This is a little bit lighter than that. Then you've got the like lacrosse balls. We do that all the time too. So very often I'll take a lacrosse ball. I can push this up against my back and push into a wall. These are pretty hard though. Sometimes we'll take 2 lacrosse balls and even tape those together, and it creates what's called a peanut. And the peanut you can lay against the wall or lean against the wall or lay on the floor with it. Now, in comparison, the lacrosse ball was much harder than this is. And I think for me, since I'm so used to using the lacrosse ball, these were a little bit too soft for me. They were a little too light. But there are patients out there that we deal with all the time that a foam roller is far too painful for them. Lacrosse ball is just like, no way, I don't want to push on that. And they're using like tennis balls to do that. Now these are definitely firmer than a tennis ball and will be very helpful in that way. The other part is if somebody were to lay on the floor in order to apply pressure in this way, sometimes it's too much. They don't have enough control of their body weight as they're laying back on it in order to not just get the full brunt of the force of the ball or whatever they're using to work out those knots. So this does allow that control. So if this was set up in your home, you would have that a place where you could then go work out knots and things there too. Now, some of the things I did not like about it was that once I got it in the doorway, it was really hard to get out of the doorway, which I guess is kind of the idea. You don't want it to be so easy to pop out. Perhaps you just find a door that you can leave it there most of the time. But you know, I'd have to be able to go up and down with it, so I didn't find it was very easy for me to go up and down. So if I wanted to work on my lower back and then my mid back, it wasn't going to be super easy for me to do that. So if you have like between the shoulder blades where it's a spot you're always going to want to work on, this is a good solution for that. This is definitely very sturdy, very strong. You can tell it's very well made. It's not going anywhere once you get it in there. This part, hopefully they've got some additional attachments or things that you can add to it, because for most people, I think this is gonna eventually be too soft for them. They're gonna get used to this. They're gonna want something firmer in there, and this will eventually be too easy. But for the person who can't get on the ground, foam rollers are too hard, lacrosse balls are too hard, this is a great solution for them. And it is something that I will certainly show to my patients and see how they like it. For me, I don't know that I will be using it because, again, the foam roller and the lacrosse ball are already something that's better for me. I'm able to get a lot more pressure in there. In fact, for some of my muscle groups, I'm using PVC pipe where it's very firm, very rigid. So this would be far too soft. But it's an interesting idea. Certainly not the worst thing I've ever seen. There's lots of benefit for the right kind of patient or the right kind of person who needs to work out knots, who can't get on the ground, and where a foam roller and lacrosse ball are just too hard. That's the Backmate. Thanks. Here's the Backmate installed on a door in our office. It's on there pretty securely, so I'll grab it and try to pull. It's not going anywhere, so it's got some foam caps here, so it's not going to ruin or break anything in your home. This part here lifts up and then it pushes down to hold it in position. It's got a little level bubble there, so you can make sure that you're holding it in a level spot. This here is where you'll do the actual trigger point stuff, and that rotates here pretty easily. It's on there pretty snugly. It has other angles, so you can twist this and turn this here too, but we're not going to do that here today. So my wife's going to demo how to use this. And so she's got it worked into there with the knot. So the groove on each side there is where the bones of your spine can go, and now you can work on it that way. So she finds a spot that's particularly bad, then she can certainly spend more time there or change the angle. So, is that firm? It feels okay?
Feels fine. Feels very nice.
How do you find that this would be helpful for you?
It's getting both sides of the spine, so it's working on the tension, which would build up probably if I was a desk worker, that you get a lot of tension right there, so you could just really dig in there and smooth out those muscles, demand the blood to flow in.
Great.